topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Arizona. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. I want to meet the person that is in charge of changing the time zones. You know, I have enough problems with 3 time zones. Now, Arizona is on mountain time, so I have to switch to that. But it's okay because we've got a great guest for you for the next 25 minutes. We have with us Dr. Patrick Sars. He's certified in neuropathy. Neuropathy, one of the most painful injury. It's not even an injury. It's so painful. And the reason I know, because we get the letters from people saying how painful it is, as well as how they lost their balance, how they're having numbness. But Dr. Sars specializes in neuropathy. Welcome, Dr. Sars.
Thank you, Steve. It's good to be here.
It must make you feel so good, because I think you get a lot of patients who their doctor said, there's no cure, we can't do anything for you, you're stuck like this, but they don't know what you know.
That's right. That kind of my favorite story that I've had here in the last month is that one of my patients that started with me about 17 months ago, and she at that time was having difficulty just walking around her neighborhood, came in about a month ago now to show us pictures of how she had hiked down the Grand Canyon and about 2 miles and walked back up, and then said she'd walked around 4 miles around the rim itself. And it was amazing to see somebody that's in their early 70s that basically enjoyed doing that sort of thing and had to give it up to be able to get back to doing it again.
I think you've got the greatest story, how you got started in neuropathy. Can you share that with everybody?
Well, basically the main reason that I got started is due to the fact that my mother developed it. I'm a chiropractor. I didn't start out in life to become a chiropractor. That I grew up on a farm and ranch, and basically you grow up on a farm and ranch, you're in the shape that you can get away lifting pretty much anything. And upon graduation from college, I became a salesman, but I still had the mentality. I just didn't have the ability anymore, and I injured my back. And had phenomenal success going to see a chiropractor. My uncle was a chiropractor in Knoxville, Tennessee. He's the one that gave me the advice finding the chiropractor I did. And I literally went in a 3.5-day period of time from being stuck at about a 60-degree angle forward with pain going down both legs into my feet to playing racquetball. It was phenomenal enough that I could actually convince my wife for 3.5 months to let me sell the house so I could quit my job and go back to school. Got to give her a lot of credit and a shout out to her, because we're going to celebrate our 44th wedding anniversary on the 2nd of January.
Wow, so, congratulations.
But I moved her from a pretty nice house here in Phoenix with a pool in the backyard that I owned when we met to a 12-year-old double-wide mobile home in Davenport, Iowa in the first 14 months of our marriage. So, and she's still stuck with me. So, but the neuropathy
She's
thing
a trooper.
She is that. The neuropathy is due to the fact that my mom suffered with it for about 32, 33 years. And she spent the last 13 years of her life basically completely confined to a wheelchair, completely dependent on my father basically to do anything, and in a great deal of pain. And that is what motivated me. Unfortunately, I never found anything to help her before she passed. But I have been able, with increasing success over the last 17 and a half years, to help a great number make sure that they don't end up in the same way that my mom was.
Amazing. Well, we've got the holidays coming up, and most people, even if they're on a diet, usually give it up in the month of December. But I know I've learned from you that diet is very important when it comes to neuropathy. Let's talk about, because people are going to be eating crazy. Let's talk about diet today.
Okay. That basically the main thing that I want people to understand is that no matter what the cause of your neuropathy, and there's over 200 known causes, if you eat a lot of carbohydrates or drink a lot of alcohol, the chances are the following day you're going to pay for it a little bit. So understand that and enjoy yourself. But at the same time, realize that there's a reason that your neuropathy got worse. We now do basically all the treatments are actually done at home in the patient's homes now, that they're able to do them themselves. But back when we were actually still doing some treatments in the office, I'd hired a new office manager, and on the Friday after Thanksgiving, I took the day off and I had Carla come in and treat the patients. And she called me at noon to tell me that everybody was worse. And it's due to the fact on Thanksgiving, what do? We eat and drink things that we normally don't do, and then we do it all day. And that just, it'll cause our blood sugar to go up. And when our blood sugar goes up, whether we're diabetic or not, it still decreases the amount of oxygen that's attached to the red blood cells for a period of hour to 2 hours. And that actually will irritate the nerves for the people that have neuropathy, no matter what their cause is. And so that'll make your symptoms worse for a little while. It'll subside quickly, but it is something that do realize that when you do that and your feet and your legs may feel a little bit worse the following day, that's the reason that it happened.
Dr. Sars, is there any food or drink that triggers neuropathy?
Per se, not something that's going to, that it's just once you have it, there's a lot of different things that can irritate the nerves before you actually do anything to kind of heal them up. And it's that's going to end up causing the problems. That once we get a patient to a certain point, most of the time they're not going to notice that foods are going to bother them anymore. But in the beginning stages of the treatment, or if you've got neuropathy and you're not doing anything about it, you're going to notice that various different things will have an effect on it. The changes in barometric pressure if a storm is going through. If you eat a high carbohydrate meal, you go out and have a lot of Italian food, a lot of pasta, that can trigger it because of the fact that, again, causes your blood sugar to rise. And when your blood sugar rises, sugar doesn't just float freely through the bloodstream. It actually attaches to the red blood cell where oxygen should be. So it decreases the amount of oxygen, and that decrease in oxygen will irritate the nerves for a period of time.
Are there any supplements that are good for people who have neuropathy?
There are a few that can help. That alpha lipoic acid is a good supplement to take, generally around 600 milligrams a day. That a lot of people will notice that can help to subside some of their symptoms. It doesn't really help to resolve the neuropathy itself, but it does give some symptomatic relief for a period of time. Increasing somebody's nitric oxide, which basically will increase the ability to absorb oxygen at the cellular level, can be beneficial, and it helps to dilate the blood vessels, so you get better circulation overall. The things this way will actually help with increasing the oxygenation of the tissues, decrease some of the inflammation that's occurring, and can give some benefit from that aspect. These things basically provide some short-term symptomatic relief, but they're not going to end up changing it overall for any length of time. And unfortunately, they won't stop it from continuing to get worse.
You know, we've gotten letters, and people have said that their doctor prescribed a certain medication, and it worked for a little while, but eventually and it stopped doing anything for them. Is there not? I guess there's not any prescription medications that really help long term.
That's pretty much true. I mean, the one that the most commonly prescribed medication is actually gabapentin.
Yes, that was it.
But studies show that actually only works for about 22% of people. About 47% stay on it. The side effects of it a lot of times end up being worse than the neuropathy itself. And like I said, it's effective about 22% of the time, but 47% of people with neuropathy stay on it because of the fact that other 25% basically are thinking, geez, if it's this bad and I'm on the medication, what would it be like when I go off? And it's pretty much the same, but they don't want to take the risk. And I can understand that. Lyrica is another one, or pregabalin. It has a little better efficacy in the very beginning, but it tapers off. That about 54% of people say that they feel better taking it initially, but within 5 years, that number drops down to about 18%.
I think, tell me if I'm wrong, there's not a lot of doctors that specialize in neuropathy the way you do. And we actually opened the show up throughout Arizona. So even if you're not in Arizona and you're catching the show, I'm telling you, it would be worth a trip to go see Dr. SARS. Dr. SARS, how do you diagnose neuropathy when they come to your office? How do you diagnose it?
Basically, I use a test that's called the Toronto Clinical Scoring System for Peripheral Neuropathy. Basically, it's a sensory exam that was developed by a couple of neurologists about 22 years ago. It's a subjective exam. Basically, we're having people rate how things feel, seven different sensations in their lower legs and their feet, or in their hands and their arms, if that's where they're having it, comparing to a spot somewhere on their face that they feel things normal. The reason that we do 7 is that we've got different nerve endings that carry different sensations. Some may be involved, others may not. So it gives me a pretty good idea of how severe something is. Probably 80% of my patients, by the time that we get down to touching their toe, they can't feel the sensation, or at least 1, maybe 2, some of them, all of them. Because of the fact that this is a progressive disease, and it unfortunately starts to destroy the nerve endings at the skin level, so that you lose the ability to actually feel these sensations. And it can change your proprioception also, in knowing where your awareness of where your feet are actually at, so your balance becomes affected. Your ability to drive can become affected, that you aren't quite sure whether or not your feet are on the gas or the brake.
This is from Michael, wants to know if you say this can be treated at home, how many treatments do you need to see before you start seeing any results?
Most of my patients will treat themselves twice a day, 5 to 7 days a week, and they'll start to notice some small, minute changes, but noticeable ones within a 2 to 3 week period of time, as on average. Some people will take a little bit longer if the neuropathy is more severe when we start, but we have a pretty good idea that we can tell people what to kind of expect and how long it's going to take. Because of the fact that nothing that I do is covered by insurance, it is all out of pocket. I do actually have a money back guarantee that you're going to get better if I take you as a patient, because of the fact that I've gotten pretty good at being able to determine who I can and who I can't help in the 17 and a half years I've been doing this. It's not a total refund, but it is 60%. What I do with the other 40%, it covers basically the supplements, and then the equipment that you had purchased and returned to me, I have to send it back into the factory to basically get it recertified, cleaned up, and that. And so that 40% covers that particular aspect of it. But that only happens in a very rare. Yeah. Yes. At this point, we've had to refund money 3 times in 2025. So, and one of the patients, I don't think actually ever pulled it out of the box. So, but he showed up for all of his appointments. It was kind of strange.
What happens if a person doesn't get treated for neuropathy?
It's going to continue to get worse. In most aspects, what they're going to notice is they're in a lot of discomfort and pain. 66% of all neuropathy sufferers will actually lose sleep because of the discomfort and the neuropathy. And so it becomes disruptive in that way. It leads to balance issues that are going to end up walking with a cane, a walker, or possibly getting into a wheelchair. I know a lot of clinics will use that it can lead to amputation, but that's actually a scare tactic that's done trying to get you to sign up for their program. In all actuality, yes, there's 180,000 non-traumatic amputations a year in this country, but 160,000 of those are for uncontrolled diabetics. So the average person that has neuropathy, which 70% of people that suffer with neuropathy are not diabetic, they're not going to have to worry about having an amputation. They probably got a better chance of winning the Powerball tonight.
Oh, okay. Michael in Phoenix, I'm really enjoying your show. I've always wondered why there weren't more shows educating people on neuropathy. Thank you for bringing your show to us. What neuropathy seems to have so many different symptoms? Why is that?
Well, because we've got different nerve endings that carry different sensations. So some people may feel like their feet are constantly hot. Other people may feel like they're constantly freezing, but when they go to touch them, they're normal temperature. It's just due to the fact that the sensory nerves, the cells at the ends at the skin level, actually die off, go deeper into the tissue, and then they fire on their own. Very similar to possibly what an amputee experienced in phantom pains in a limb they no longer have. And so those nerves are firing and giving them the sensations that their feet are cold or they're hot or they get sharp shooting pains. And it just depends on what nerves are involved, because we have nerves that carry cool and cold, heat and hot, the pain fibers, light touch, and depending on which ones are involved is going to determine on what kind of symptoms you actually have. You can have a very minor symptoms, or you could have all these nerves firing at the same time, and you basically a lot of confusion from that particular aspect. I know it's difficult for a lot of people to understand how somebody with neuropathy can express that their feet are numb and they hurt like heck at the same time, because the average individual has no concept that they go to a dentist and get a shot of Novocaine and their mouth's numb, and the dentist goes in there and does all kinds of things and they don't feel any pain. But it's due to the fact that the nerves that are rescinded, that some nerves, particularly the ones that carry the sensation of cool, will cause your feet to feel numb as they recede deeper in the tissue. And then the pain fibers get involved. Well, they're going to give you pain at the same time. And so both of them are firing simultaneously. And so you end up with a sensation of numbness and pain. The thing is that as time goes along, the pain can start to override the numbness. That one of the things that I kind of get a kick out of, but at the same time, it's alarming to the patient, is that as the pain in their feet go away, they go, geez, my feet, I don't have the pain anymore, but now they're numb. It's like, no, they were numb before. It's just the pain was overriding the numbness.
Right. Why does it disrupt sleep?
Due to the fact that the nerves primarily will bother you more at night than other times, particularly in the beginning stages. Okay, you're not going to lose all of the nerve endings at one time. So when you're up and doing things, you've got your shoes and socks on, you're stimulating the normal nerves that are there. It can override the abnormal sensations to a large degree. But at night, when we take our shoes and socks off, there's nothing stimulating those normal nerves. So the abnormal ones become more dominant. The analogy that I use is, as a kid, when I would hurt myself, my dad would joke with me that he could make any pain in my body go away if I'd let him hit my thumb with a hammer.
That's a good analogy.
At least I think he was joking. So
Yes, I do too. Let me try to get as many of these questions that are coming in. Um, this is from, I guess, female, Paris. She wants to know, why do you have your patients treat their neuropathy at home?
due to the fact that it is just that, it is a treatment. It is not a cure. There are according to the Mayo Clinic in Scottsdale, there's over 200 causes for neuropathy. Neuropathy does not start on its own. There is always an underlying cause. 30 to 40% have idiopathic neuropathy, and that is, we know you've got it, but we don't know why. So we're not able to identify that cause. And unless we can actually correct the cause, we're not going to be able to cure the neuropathy. And so this is an ongoing treatment. It is something that they will be doing for the rest of their lives or until something else comes down that can actually affect the neuropathy more readily. So we got an eye-opening experience in 2015 that I'd been treating neuropathy for about 7 years at that time. We called about 200 patients that we treated from 2008 to 2014 to see how they were doing. And all the patients that we called were doing tremendously better when we released them from care. And when we called them, what we heard is that they were as bad, if not worse, than they were when they first came to see me. So what we found and what I realized is I've got a great treatment for it. It worked really well, but I wasn't curing neuropathy like I thought I was. I was actually just treating it. So we've gone to a home treatment protocol. The type of treatments that we do now, that advances in technology that have occurred in the last 5 years, have gotten us up to the point that 98% of our patients do get better. And
That's amazing.
And so that part of that's due to the fact I do know who I can and who I can't help. So we're not just taking everybody. Back when I started in 2008, I thought I could treat the world and treat everybody. And over the time, I've learned who we can and who we can't. But this new technology eliminated some of the things that I still don't understand on why the older models and versions of it didn't work. But this new one, I use a form of infrared light to treat neuropathy. Not all infrared units are created equal. The ones that the average individual can buy on the internet, basically, they'll look nice, but that's about the only thing that they're going to do. Unfortunately, the technology that's involved, that infrared is an invisible form of light that produces heat. And so the units that were on the market, that people with neuropathy lose the ability to feel heat. And so the units that were manufactured prior to the one that I'm using now, there was a ceiling as how much energy they could produce, because if you produced more energy, you'd produce more heat. And so you could actually risk inadvertently burning a patient without them being aware of it. And so there was a ceiling as far as how much energy any of these units could actually produce. This new unit came out with a new type of diode, dissipated the heat, increased the energy output by almost 4 times what was on the market prior to that, and literally has changed the face of my practice on what we've been able to accomplish.
Dr. Sars, how do people who are listening on iHeart and on Spotify right now, how do they make an appointment with you?
Just call us, 480-556-1358. The phone is answered from 7 a.m. to 8 p.m. daily, Mountain Standard Time. Outside of my office hours, I'm the one that's going to be answering it, so don't be surprised. My patients treat themselves at home. They need to be able to get a hold of the doctor, and that's how I make myself available.
Dr. Sars, I am so glad we have you. I want to wish you and your family a happy holiday and a happy new year. You'll be back again with us next month. We so appreciate your knowledge. Thank you, Dr. Sars.
Thank you, Steve. You have a happy holiday and a happy new year also.
Thanks, my friend. That's Dr. Patrick Sars. I'm telling you, if you think you've got neuropathy and you're in the Arizona area, you want to reach out to him. That's going to do it for us today. I don't think are we going to be on next week live?
No,
we're not. So we'll be here, but we'll have some great pre-recorded shows. We'll see you next week.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.